Okay, good morning everyone. My name is Rhiannon Moran and I'm the Member Support Officer here at the Royal Australasian College of Physicians. Can you hear me at the back okay? Great. I will be conducting your basic training orientation day today. First and foremost, I'd love to welcome you to the college and I look forward to helping you through your journey, your training journey with us. Today's presentation was brought to you by Avant Insurance and they'll be saying a few words later on. The purpose of this session is to give you an overview of all things you need to know, where to find more information, and to get you familiar with the terms that the college uses. As it says up here, Physician Readiness for Expert Practice, which we like to refer to as PrEP. So in future, when I or your supervisors or the college refer to PrEP tools, PrEP requirements, we are referring to the training program tools and requirements. I'm hoping most of you have already applied to the college. However, I wanted to remind you of the process in case you haven't or are thinking of applying at a later date. You are eligible to apply to the college from your postgraduate year 2 year. That is, once you've completed your first postgraduate year. Can I just get an indication, have most of you applied, or who has applied, I should say, if you just put your hand up? Great, that's the majority of you. As most of you know, applications can be made online or by paper-based. If you're waiting for your application to be processed, please be patient. It generally takes 4 to 8 weeks from the closing date. Please also keep in mind your Director of Physician Education, which is your DPE, also needs to approve it. Remember, with the college, you must prospectively apply every year, so don't forget to do it again next year. Just to let you know, for those who wish to apply at the end of the year, the applications for the second half of the year open in June, so just a good thing to keep in mind. Okay, so here in New South Wales, we do have a shared space with HETI, which is the Health Education and Training Institute. I would also like to take this opportunity to remind you that the college does not assist trainees in finding training positions, that this is your responsibility. For information about BPT New South Wales network positions, please see the HETI website. So, your journey. As you can see from the slide, the learning journey starts with 3 years of basic training. After 24 months, you are eligible to sit the written exam. Once you've passed the written exam, you then move on to the clinical exam. You must pass both the written and clinical exam in order to move on to advanced training. Advanced training generally takes between 3 to 5 years, depending on what specialty you decide to do. So as you can see, here is an overview of adult medicine training requirements. As you can see, you must complete a minimum of 24 months of core training, which includes 12 months minimum in medical specialties, 3 months minimum in general and acute care medicine. You must also complete a maximum 12 months non-core. However, this can be replaced with additional core training. Please also note that we have flexible training options if you decide to interrupt your training or go part-time. More information on the flexible training can be found on page 22 of your basic training orientation guide. I highly encourage you to familiarise yourself with the training resources. By now you should have received your BT orientation guide and your PGY2 New South Wales booklet. That is unique for New South Wales. As I said before, we do things a little bit different here in New South Wales. We also have the basic training adult medicine handbook, and that's available online. So please familiarise yourself with everything in this handbook. This will be your Bible throughout your journey. Now, there is plenty of support, both within the hospitals and here at the college. I'll go through some of your support network in New South Wales. In New South Wales, you have what it's called a PGY2 supervisor, and a list of supervisors are available on our website. Your Professional Development Advisor, also known as your PDA, is your mentor and go-to person. While it is optional, we recommend it and encourage you to meet with your PDA twice a year. Your Director of Physician Education, which you'll hear me refer to a lot, which is your DPE, oversees, organises and supports you within the hospital. Your ward consultant or run supervisor is your day-to-day person to go to on the ward. Your education supervisor, your ES, is your direct report for mid-year and annual supervisor's report and is also a mentor. In terms of the college, you've got the basic training unit. They are the experts in basic training, so please direct any basic training queries onto them and they'll get back to you in due course. You've also got myself. I'm the medical support officer. I provide practical on-the-ground training, advice for BT programs as well as AT programs, and I'm often in and out of the hospitals running workshops and other events for the college, so make sure you make yourself known to me. We've also got the member services department. Contact member services for any urgent matters and they'll put you through to the right person. It's a bit of like a call centre, but obviously a lot more knowledgeable in our programs as well. And most importantly, we also have the training support pathway. This service is here to help you if you are having difficulties meeting and completing your training requirements. So I know, I'm aware at the back this may be hard to see. However, on page 8 of your orientation guide, it's a little bit set out a little bit clearer. As you can see, there's a lot to take in regards to prep requirements. These are the prep requirements required for your training this year. I was at a workshop with DPEs this week and they wanted to stress the importance of prep requirements and reiterate to you that you are responsible to complete these and to get them in on time. Often, a lot of times, people come to them at the end of the year or the end of the training rotation. The supervisors are busy or are going on annual leave and they just don't have the time, and then you don't want your training to suffer because you didn't get the paperwork in on time. Yeah, so please don't leave it to the last minute, and I will go through each prep requirement now. So your LNA, which is your Learning Needs Analysis, is a plan, is to get you to plan what you want to learn and achieve on that rotation. The LNA is designed to put you into control of your own learning. You use this tool at the beginning of your training rotation to come up with exactly what you want to achieve out of that rotation. For example, you may want to get a better handle on ECGs or cardiac failure. Use this tool as an opportunity to discuss your plans with your educational supervisor so you're all on the same page. Your PQR, which is your Professional Qualities Reflection, is all about reflecting on what you have learned and how far you have come. As the slide says, it does not need to be dramatic or life-changing. It can be both positive and negative. Example questions include what happened, why did it happen, and what have you learned. Your PQR can relate to a variety of encounters, such as interactions with the patients, families, communities, or other healthcare professionals. Your Professional Development Advisor will assess you on the PQR, which you are required to complete every 6 months. The Mini CEX is there to evaluate you, the trainee, in a real-life setting and assess your clinical performance. Your supervisor will assess your performance and provide feedback on how you went. It is your responsibility to put the information into the portal in order for the Mini CEX to be complete. A Mini CEX should be completed each rotation and is a great opportunity to receive feedback from your supervisors. So here you have a screenshot of your own personal basic training portal. Once your training has been approved with the college, you'll be emailed a MIN number, which is your member identification number, and you'll be able to log on to your portal. I highly encourage you to familiarise yourselves with the college portal. This is where you'll be completing your prep tools, such as your LNAs, PQRs, and Mini CEX. You must regularly check your portal to ensure that your training dates are correct and approved by your supervisors. All requirements for 2016 are due by the 31st of January 2017, but as I said before, just make sure you get these in early, then you can tick them off your list and your supervisors won't be angry at you at the end of a rotation and say, look, I don't have time to do it now. You must make sure that these are submitted by the due date, otherwise it could come down to your training not being certified. I previously worked in the advanced training department and saw people not go through fellowship or have their fellowship postponed 3 to 6 months because they didn't complete LNA that year or a year prior. So it really is important. So your mid-year and annual progress report. Your annual progress report covers obviously the whole year of your training. Your mid-year progress report covers the first 6 months of training and is due on the 31st of August. This report is completed by your DPE or educational supervisor. So your Advanced Life Support Certificate, you must complete an ALS course before completion of your basic training. Many hospitals run their own ALS courses, otherwise there's a wide variety available on the internet. Your ALS certificate needs to be mailed to the basic training or can be uploaded as part of your annual application form. So these are your important dates. Once again, this is all available in the resources that I provided you with today. Put these in your diary, just be clear on when everything is due, because once again, it is really important. You don't want to pay late fees. You don't want your training to be tarnished because of paperwork or some other prep tool that you haven't done. So the not so fun part, the cost. Instalment options are available and you can seek a full refund if you decide to change careers within the first year of your training. You just need to make sure you notify the BT unit and complete a withdrawal form as soon as possible by the end of the year. Also with the basic training unit, just please keep them up to date, exactly what you're doing. Anything you decide to do or any advice, just please contact them before you embark on what it is you want to do. These are the main policies. Obviously, we have a lot of policies that I highly encourage you to familiarise yourself with. These can be found on our website, online, and also in your booklets today. Please make sure you regularly check our website, as this is forever changing and new updates and changes to policies happening quite frequently. Please remember that the college is run by fellows and we are here to support you. All decisions are made through wide consultation through committees as shown on this slide. There are regular expressions of interest that go out. Every committee has a trainee representative. So make sure you keep an eye out, and I highly encourage you to get involved because there's, especially with the trainees committee as well, they're forever looking for new basic trainees to join and just to get a wider audience and advocate for the trainees. So that brings me to the end of my presentation. As I said, everything I've discussed with you today can be found in your guides. I'll be back later on to answer any questions you may have. I will now, just in time, hand you over to Jennifer, who will be sharing her own experience on her training journey. Thank you.
Okay, so I struggled a little with the parking and the traffic, so thanks for being patient with me, Rhiannon. So my name's Jennifer. I'm a first-year medical oncology advanced trainee working at Lighthouse in Concord. So I've very recently finished my BPT journey, and I'm very happy to take any questions that you may like to throw at me at any time. Make this casual. So I guess Rhiannon's already gone through quite the official stuff about the prep requirements. I'm essentially just going to give you top tips that I've found things that I wish I knew when I started. Keep on top of your prep requirements, write them down just so you are aware of them. As she said, there are 4 mini CEXs, 2 professional qualities reflections. Did any of you go to UNSW? Pretty much like a portfolio. Thought you were done with it, but you're not. And 2 learning needs analyses. Make sure you enroll in exams on time. There are quite a few cautionary tales of people who've just missed deadlines and had to pay another $600 to possibly, appeal the decision. And the last thing is money. Now, I know this might sound a bit mundane, but you're looking at about $12,000 to $14,000 over the next couple of years. And so just don't end up like me with a $10,000 credit card debt at the end of it. Not a great idea. So just giving you a heads up now. Top tips, I've found smartphone and iPad apps to write down various things for yourself, reminders of when things are due. I found something really helpful is writing down the ethical and professional dilemmas that you come across day to day, whether that's looking after a difficult patient, dealing with a difficult senior or junior, anything of the sort. If you're finding that you're struggling, just write it down so that it's something you can reflect on later, because when you actually have to write the thing, you'll be like, oh my gosh, I don't know what to write about. It's really helpful. Make sure you sit down with your supervisor early with regards to your learning needs requirements, learning needs analysis, so that you can work out what you need from the term, work out what they're happy to provide for you, and it's actually really helpful for yourself professionally rather than just as a box to tick. So if they don't mention it in the first 2 weeks, ask them if you can sit down to discuss it. And advanced trainees can sign CEXs, which is very helpful, just so you know. And when you're finally actually preparing for your clinical exam, you will be doing so many short cases, I don't want to scare you. But if you bring along your CEX forms, you can just smash it in a couple of weeks, really. You're just doing short cases all the time. So, and then it's really annoying at the end of your exams, because there were quite a few people who didn't bring their paperwork, and they're like, I have to do more mini CEXs after you've already done all your short cases. So if you just remember and you're just a bit savvy with your paperwork, it'll all be done. The savings, I've calculated it to be about $250 a week if you put it aside. You will not end up in my situation. And keep your receipts. Tax returns, it's actually quite rewarding finally. So the next thing I'm going to talk about is a little bit about the mystique of the med-reg and how to approach that. Things like this made me super nervous. I think as a resident, you grow up thinking that the med-reg is going to save you, save the hospital. And then when you become the med-reg and you realize all those expectations are on you, everything suddenly seems a whole lot scarier. What I really want to do, though, is reassure you that even though that might be the ethos and the mystique of the med-reg, what your job really is to just be a thorough, good doctor and a good communicator. Okay? All you really need to do is to be able to take a good, thorough history, examine the patient properly, think well about the investigations, and have some idea of what's going on. You don't have to know exactly what's going on. You don't need to have all the differentials, but just enough so you can communicate it clearly to a senior so they can help you out. Okay? When I realized that's all I needed to do, especially in my first year of BPT, when there weren't actually all those expectations, that was such a load off my shoulders. Okay? Communicating well to your juniors is also important. You don't need to feel like you need to show them everything, you need to know everything and more than your junior. That's not true. You just need to be able to share your jobs, delegate well, and be sensible. Okay? And everyone who's come this far is sensible. You can all do a history and an examination, and the rest will come with experience and with study. So please don't feel terrified. Call for help, especially in your first year, even in your second if you don't know what's going on. You will never get in trouble for admitting that you're not sure what's going on and that you need some help, all right? And even if you do get in trouble, don't worry about it. The patient safety is what matters, okay? I also want to tell you to give yourselves a break, and our study group gave each other a month before we actually launched into the questions, because we all wanted to be a little bit more comfortable with the idea of being a med-reg before we also bombarded ourselves with MCQs. And that was fine, okay? So you can be a little gentler with yourselves rather than thinking you need to start everything all at once. I might just stop here. Does anyone have any questions already? Nope. Okay. My friend shared this, and it's true to an extent. The confidence will come, but if you start with it, you'll actually feel a lot more, even if you are projecting it, you'll feel a lot more comfortable already. I also thought it was very cute. So how to study? This might seem a little overwhelming. but here we go. Study groups. I guess are you guys BPT 1s or 2s? Most people in a study group already? No? 1s. Okay. So I guess starting to think about a study group is helpful. Once you're allocated to your networks and you know who you'll be around, you know that you might be able to solidify it a bit more. I don't think I could really have gotten through study without it. There's just so much ground to cover. And it's also really nice to have people that you're accountable to, you know, rather than saying, yes, I'll do all these MCQs, and then you don't. But you have to do at least 5 every week for your group, and they'll teach you their own. So we were covering about 25 MCQs each week. And at the beginning, that might sound like a lot, but it's at least, you know, you're covering ground. What really happens by the end of the year is it's sort of this war of attrition. The knowledge eventually gets down to you after you've heard it for the 5th time. So you do it with your study group, say hepatitis C, then you listen to the PEP lecture if you're nice and conscientious. Then your hospital teaching program might also have some lectures, like just the internal lecture program. Then you'll probably go to the study course, either Dunedin, Delta Med or RPA. And by the time you get to that point, you'll be like, yeah, that's right. I've heard about these direct-acting antivirals. I know about, you know, complete virological response, sustained virological response. And so by November, when you've heard things again and again, they start to make sense. So don't feel overwhelmed if you're hearing about it for the first time and you feel like the knowledge just isn't staying in your head. That's a common experience. It will eventually get there, okay? So be gentle with yourselves. Important resources that I think get missed a bit, there is the curriculum that the college actually provides, and that's a very helpful guide to know what is important for you to know, like you have to know in detail, and some things that are good for you to know in slightly less detail. And the ETG and various other Australian resources, because while up-to-date is great, and we relied on it a lot for our MCQs, it's important to know that you're essentially going to be quizzed on what we do in Australia and what's common, standard, accepted practice here, okay? So there might be these new fancy, sexy drugs that are not yet TGA approved. Can't be quizzed on them, okay? So try to, you know, bring it back to what's relevant to current practice. Any questions about this? Nope. This is just an example of the curriculum. It's probably a bit small for you to all see, but it's the endocrinology subset. Essentially, it talks about the basic sciences. The orange is stuff that you need to know in detail. So interestingly for this, it's diabetes, type 1 and 2, osteoporosis, and obesity. Got to know those, back to front. But the other things, the thyroid disease, the Addisons, the Cushing's, hypogonadism, all those, you know, weird pathways that, you know, will be your fun and joy for the next couple of years, those are sound understanding. So it sort of tells you where you focus your time, I guess. So I would encourage you all to download the curriculum and have a look at it and let that actually inform your study as well. So what I did was I sort of, I'm a real iPad app sort of person. So each subject or topic, say hepatitis C, I'd have one document. And I'd put down the take-home notes from the PEP lectures on that document. And then when we had a lecture at work, I'd open up the same document, write down the same what take-home messages from that lecture were, added the same from Delta Med, so that by the end of it, you've got these master documents, as it were, from all of these resources that you can compile rather than going through multiple notebooks or bits of paper. So I found that super helpful. I guess if you're interested about a time frame, I guess October and November is sort of when you should start to finish the majority of your coursework, like cover most of the topics. And you'll find that, you know, there'll be more and more pressure around that time because that's when the courses are, and that's when your networks will start talking about trial exams, and you'll be like, oh my God, really? Is it that time? And that's when you have to start, well, I guess a lot of us sort of start cramming the lists and equations and the things that I guess for the highest yield, you learn as close to the exam as possible. Things like genetics and statistics and the nibs and the mabs, you know, various lists. That's when you start doing it. And also once you start doing your trial papers and you realize, I really suck at neuro, that's when you start focusing on your specific areas of deficiency. So by January, you're feeling reasonably comfortable. By February, I would say the week or two before the exam, probably wind back and calm down. Now, I guess the last thing I was going to mention, or the second last thing, was co-curricular stuff. And it's sort of a bit of a heart sink because I know you're only starting to think about this job, and then no sooner have you gotten this job that people are starting to ask about your next job. What are you thinking about? What sort of research projects are you going to do? And the whole thing just feels incredibly stressful. What I would suggest would be not to dive straight into extracurricular commitments right away. I guess the first thing that's practical is that most of you will be seconded from your home hospital for the first 6 months anyway, and it's pretty hard to commit to a project or something in that time frame. But I also think it's reasonable for you to sort of work out how to be a med-reg and work out how you're studying and give yourself a little bit of time to see how you're coping with that before you then sign up to a PhD or a research project or lots and lots of teaching or clinical governance. These are all options. Joining the committees that Rhiannon has mentioned, also great options. And I guess the main thing is to work out what you actually enjoy of these things. Now, I know that you're meant to cover all of them for your CVs, but to a certain extent, you find out, I actually love committees. I love clinical governance. I love making things better. That's actually fun for me. So I can do that without feeling like, oh, you know, a real heart sink, because you don't need that many heart sinks for the next 2 years, let me guarantee you. So find what you actually enjoy and try to invest your time in that. That would be my suggestion. Now, I know Paul's going to give you a bit more of a talk on this, but some general principles about keeping yourselves sane for the next 2 years. Obviously, keep healthy, exercise, try to eat well, try to sleep. I found that surrounding myself with supportive people was helpful. So our study group, you know, we had the great benefit of also being really good friends, and we were able to help ourselves through it. You'll all find, I think, when you start, there are certain people, either within your cohort or at other hospitals that you'll come across, who are just so intense, who know so much, and who just freak you out. And if you spend too much time around those people, you might find yourself in a crying mess because you just think, I can never be like that. That's okay. The world is big enough for lots of people. And if you're with your supportive friends and you realize, that's okay, I can just be a good, sensible doctor who gets through it, that's fine. Okay, so that's one big tip. Keep a hobby, give yourselves 1 to 2 evenings off. In the first few months, I would definitely, you know, at least, I thought until July, about July, August, I didn't start turning down invitations to study, if that makes any sense. So, and then obviously as October and all of that draws closer, then you might have to start declining invitations and start crawling into that hole. But don't do it at the beginning, you'll go crazy. One other tip that I found was really helpful, especially if you have non-medical family, like a non-medical spouse, to warn them in advance about what the next couple of years will look like is very helpful. One of my friends had the line, which I used as well, that the next 2 years are not going to be fun, but the worst case scenario is that I have to do it again, and neither of us wants that. Okay, so that's how we sort of got around it. So studying a lot is not really great for the people around you, but just warn them. But try not to disconnect completely. I know that sounds like it's contradictory, but the exam is not the end of the world and it's not the biggest thing in your lives. Okay, so try to keep some perspective. Support networks, family friend study group, your DPET and medical super, the college itself can be helpful as well. and try to minimise time wastage. I think that's the most helpful thing, really. If you're spending hours on Facebook, then you do feel a lot more stressed because you're not sleeping and you're not studying. So that's helpful. And that's essentially the timeline I was saying. And questions, please. Any questions? Nope. Okay, no worries. Well, we'll see you at the panel at the end, I think. All right. Come on, Paul.
Thanks, Jen. I thought I might just start off with a few comments on Jen's talk and also on Rhiannon's thing. So a lot of you, I'm guessing, are PGY2s. Put up your hand if you're PGY2. Okay, good. So a lot of stuff which Jen was talking about was things that you're going to be doing next year. But what should you be doing this year? So my sort of approach to that is to take things a little bit easy and concentrate on being the best doctor you can be. Read around the cases that you're doing, sort of learn a little bit about how to be the best doctor you can be. Speak to your med-regs about how they organise their day. Speak to them about how they approach their transition into becoming a med-reg. And by the end of the year, you should really be thinking on the ward rounds like a medical registrar. You should, in fact, you should be bored of being a resident. Residency should be the most boring thing in the world. You hate discharge summaries. You hate writing, doing your blood rounds during the day. You should hate being a resident by the end of the year. And that's a good sign because it means you're ready to take the next step and move up to be a medical registrar. If by the end of the year you're still liking discharge summaries and you think, oh, I could probably do another year of this, then maybe do an SRMO year. Because you really should be bored by the time you're becoming a medical registrar because you're ready to take the next step. Sometimes you've got to be pushed and you just want to take that next step, and that's okay as well. So that was just sort of a comment on Jen's stuff. I'll just load up my talk. The comment that I had for Rhiannon's talk was everything she said was true. The college, essentially you need to keep in your head that your employer is very separate to the college, and they're two separate things. And it was something that I didn't really get until advanced training. The college is an educational provider that has zero interaction with your employer. And the only interaction, and essentially the employer, is providing you with experiences and skills which you then tell the college about, and the college accredits you for that training and time. Okay, but there's no talk between the employer and the college directly. So when you are submitting forms to the college on things which you've done on the ward and things like that, you shouldn't be thinking, oh, I just did a term, the college surely knows I've done this term because I'm employed and they know. They don't. The college and New South Wales Health don't talk. The second thing so make sure that you tell the college everything that you're doing. The second thing which Rhiannon said is make sure you get your paperwork in on time. The college is very inflexible with, I mean, there are the avenues to challenge and to seek recourse if something goes wrong. But if you don't put your paperwork in on time just for the sake of not putting it in on time, it's a big hassle for you. And I'm meaning months of letters and writing a letter saying why it happened and getting support from your DPED. It's a real hassle. Make sure that you get it in by the right time and the right date, or else big trouble, okay? The third thing which I wanted to say has totally slipped my mind. It'll probably come to me as I'm going through my talk. So, work-life balance in BPT. So I've tried to sort of focus this more on work-life balance in BPT 1 so that you can sort of have a think about what it's going to be like, because I think it's easier to achieve work-life balance as a PGY2, as a resident, and it's a little bit more difficult next year with the exam upcoming. So I'm the Network Co-Director of Physician Training at Prince of Wales Hospital, the East Coast Medical Network. Oh, that's right, that's what I was going to tell you, a little bit about the network system in New South Wales. So in New South Wales, unlike other states, we have a networked system of physician training. So I'm the network director of the East Coast Medical Network. I'm a network director that looks after about 5 hospitals, each of which has its own director of physician education. So I look after Prince of Wales Hospital, Lismore, Shellharbour, Wollongong and Port Macquarie. And each of those hospitals will have their own director of physician education, and that's what's really what Rhiannon was talking about the DPE. Depending on the setup of your network, sometimes the NDPT is also your DPE for the college, but the NDPT is really a structure that's been put in place by the employer, New South Wales Health or HEDI, to help manage these networks. So you need to sort of get an idea within your network that you'll be applying to next year who you're going to for these various requirements. So, because sometimes it will be the NDPT, sometimes it'll be the DPE. That's enough about structures. So let's talk about work-life balance in BPT. So it can sometimes feel a little bit like this at the start of becoming a medical registrar. It seems like an unassailable journey. But really, there's not too much difference between being a resident and being a medical registrar. As a resident, you will know on after-hour shifts, if you go and assess a patient, you'll do your best and thorough job as you can. And if you're uncomfortable with something or you're not sure where to go next, you'll call the medical registrar. And the medical registrar will give you their thoughts and assessments, and they'll tell you what to do. As a medical registrar, you go and you assess the patient, you do a thorough job, you try to figure out what's going on. If you don't know what's going on, you call your consultant. And the consultant sort of tells you what to do. As a consultant, if you go see a patient and you don't know what's going on, and you get a consult from another team. So there's always someone to ask. Okay? And this is the way the hierarchy in medicine works. So don't feel that just because you're next year when you become a medical registrar that you suddenly have this title that you're a medical registrar and you should be omnipotent and know everything and be the font of knowledge for all your residents. That's not the case. It doesn't happen overnight simply because they put on your badge that you're a medical registrar. Okay? So you've always got someone to ask. As Jen said, the worst thing you can do is not ask. So I think there are some times when we've had medical registrars from a whole lot of hospitals I've worked at before who felt that it was a sign that they didn't know enough if they asked for help. And they ran into a lot of trouble. Patients deteriorated, the boss didn't know what was going on, and that was a big problem. So ask. Anyway, so it's not as insurmountable as it may seem to you at this stage. I think Jen's little picture of the kitty line was great. I think just think, yes, I can. And keep on saying it over and over and over, yes, I can, yes, I can. And you'll get there in the end. But how do all the pieces come and fit together? And hopefully I'll take you through a little bit of that today. So at the moment, you're probably a fairly content junior doctor, and that's all right. But there's jobs coming up and you'll need to apply for a job, and you might be thinking, oh, where do I go? What should I do? And then you think, oh, do I apply for 2 networks, 3 networks? What do I need to put on my CV? Oh, I don't have enough on my CV. It's terrible. So you might start looking like this. And then it's the night before the interviews and you start pulling your hair out. You can see that this person hasn't had a haircut for 6 months. And then you do your interviews and you're anxious. What have I got? Where am I going to go? Did I even get a job? And then you get a job and you're happy again. And then you start the cycle again because you've got the written exams to start thinking about. So getting ready to be a medical registrar. So these are some tips of to-dos before you start the year. And I've previously given this talk to people who've just become medical registrars, and it's almost too late. So I'm glad that we've got this audience now so I can tell you what to do this year and get yourself organised before next year. So before you start next year, do a health checkup. So make sure that you go to the dentist. The number of junior doctors who haven't been to the dentist for a couple of years because they can't find the time is really shocking. Dental health is important. I'm not a dentist, but it is. Go see a doctor, get a GP. Don't see your friends for scripts. Make sure that you've got a doctor who's looking after you. Don't look after yourself either, okay? Go see someone else. If you've got mental health problems in the past, get in touch with your psychologist or psychiatrist. And it's important just to, if you do have those sorts of problems, make sure that you keep a bit of just touching base with them from time to time, every 6 months, every year, something like that, because next year will be stressful and it can bring out a lot of issues in people. So just make sure that you've got on a firm, solid psychological footing. And lastly, see an optometrist, get some cool glasses. It's really important that you look good on the ward as well, so it's a good chance to do that before you start. Get your finances in order. So do your tax. The number of junior doctors who don't do their tax for 2 or 3 years is crazy. So do your tax. Get an accountant. They'll be able to find little things that you can get money back on. So all of Jen's fees for the courses and the RECP came to $14,000 over 2 years, so about $7,000 per year. That's about $3 grand straight back from the tax man at the end of the year. It's pretty good. You can go on a holiday to Thailand for that or something like that. So make sure you get your tax done and claim all the tax deductions that you can, because there are a lot when you're studying. Get a financial planner. They'll be able to help remind you about those things that you should be deducting, but also they'll help you think about planning for your future. So how do I go about getting a home loan? How do I go about doing something with the money I've got? It's something that I found particularly useful because I'm not very good with money. Like, I'm good with medicine, I'm not good with money. And it's good to give that to someone else to look after and go, I need some advice on this, just the same way that you wouldn't expect your financial planner friend to treat themselves for pneumonia. You probably shouldn't be figuring out what you should be doing with your money and accounts. And salary sacrifice. How many people have actually set up salary sacrifice? About half. It's not that hard to do, and most of the hospitals help you get it done. It saves you quite a lot of money. It's not as advantageous as it used to be, but it's still pretty good, and it'll save you probably $4 or $5 grand a year if you do it. I mean, that's hard money. $5 grand's a lot of money. It'll probably take you half an hour, so that's easy bread. Yeah. So sort out your house. Find a place to live, set up a study area, get ready for nights. It's amazing the number of people who are moving house the week that they start being a med-reg. I think moving house is the most stressful thing you can do. So try to do that before you actually become a medical registrar. Get ready for nights is something that I sort of tell a lot of my junior doctors. There's a podcast on it on the wards, which I've done. So if you want to hear my sort of thoughts, I'm a sleep physician as well. So if you want to hear my thoughts on how to prepare for nights, go to On the Wards and have a listen there. Jen touched on this about relationships, so talk to your family about next year and how difficult it's going to be. I don't think you should blow them off, though. You should still attend all your family affairs and functions, but some of your non-medical friends mightn't understand, and certainly towards the end of next year, when it's close to the exam, you will need to sort of hole yourself up at home a little bit and decline invitations to fun things. So make sure that they're aware of that. If you've got children, you need to think about how you're going to manage that as well, and you can talk to people who've gone through that before. Might be the easiest way to do it. And have a good talk to your partner as well to make sure that they're supportive of this stressful period that you're going to go through the year after next. Try get your life in order with your laptop and your computers. So you'll be taking a lot of notes next year, and I think it's important to have a computer that doesn't take 10 minutes to turn on, that you've been using since first year uni. So have a look at that. And internet is obviously pretty important as well. So that's sort of things on your to-do list for the next 12 months. The next is about balancing work and play. So this is really important, I think. Not enough people do, particularly in their medical registrar years, is use holiday leave for holidays and use your study leave for study, and don't let the two mix. we work in a pretty stressful job, and I really think it's important to take some time out, and holidays are for that reason. So there will be times where you might need to use a holiday, some annual leave for study, like the study courses, because I think you only get 7 days study leave a year, but the study courses are 10 days, so you might need to use some for that. But as a general rule, try to go on a vacation somewhere and take a break when you go away. Keep physically active. Jen mentioned that. So we don't need you to be triathletes, but it is important for your mental health to get out and walk around and keep relatively fit. Join a group activity, particularly this year it's a good thing to do. So when I was a resident, we did a few things. We had a schnitzel night every Thursday night at the RSL, which was a lot of fun. We had, well, in my first year of uni, we did, not uni, of when I was an intern, we did I was in a choir and we sang a bit. So something where you're doing something non-medical is important, I think, just so that your head's not in that space, so you can unwind. Jen said this, it's okay to have nights off. This is mainly for studying for next year, but try and have 2 study-free nights a week. And dedicate some time to family and friends. Put it into your timetable so that they're not forgotten as well. And keep an eye on the bigger picture. And I'll talk a little bit about that in the next couple of slides. But I suppose that the summary of all of that I've just said is really don't neglect the rest of your life. You know, it is very easy to, I suppose, overwhelm yourself in the hospital, to bury yourself into it, and it becomes your family, it becomes your life. You're there significantly longer than you should be, and it's easy to forget that, you know, you need to do the groceries, you need to do the washing, you need to see your friends, you need to do your tax, you need to claim your salary sacrifice. So don't neglect the rest of that. It is really important. So, getting ready to be a registrar. So I mentioned this sort of a little bit. So spot the difference. New South Wales Health is your employer. The RACP is the vocational college. New South Wales Health provides you with training, but the RACP provides you with education and supervising your education. New South Wales Health, they pay you. The RACP, you pay them. So make sure you know the difference between the two. They do have separate policies for very similar things, so make sure that you're aware of your work rights at work. There's an award which you can read, and currently it's being renegotiated by ASMOF, and previously it was HSU. So you can have a look at that and check what your entitlements are. But you've also got entitlements with the college, and Rhiannon put up some policies that you can read as well, based on leave, flexible training, things like that. There are different forms for what may be the same thing. So when you apply, if you're going on holidays for 4 weeks, or if you've got an interruption, say you need to go off on maternity leave, you need to tell both your employer and the college, because remember, they don't talk to each other. So just remember that you may need to be doing 2 forms for 2 different organisations. Similarly, there are support pathways for both sides, both the college and for the employer. So, qualities of a super med-reg. And this is just something I was thinking about last night, and sort of things which I look for in a medical registrar. So I think a medical registrar is generally caring and empathic. They're a team player. They're organised. They're fairly affable and friendly. They're medically competent. But they don't know it all, but they're competent, and they're selfless. They think about others often before themselves. That's just sort of the list I came up with last night when I was writing the talk, but I don't think it's confined just to those characteristics, but certainly they're the ones which I think I'd be striving towards over the next 12 months. Over the next 12 months and beyond, your Hospitals will put on several programs for you, teaching programs, education programs. You'll have the opportunity, being BP1s, I'm sure, to try be a bulldog for the college exam later in the year. Try to take every opportunity that's been given to you, because it does build your portfolio, it builds your CV, but also it gives you a huge amount of skills that you can take moving forward. I think now is a good time to start working as a team. Because then it'll be so much easier for you to do next year when you become medical registrars. So run things past your colleagues. It's a bit like PBLs, have a chat about cases. And if you want to start, not a study group, but just talking with your colleagues about cases, it's a really good way to bounce ideas and learn around the cases that you're seeing. Be kind. There's so much, in some hospitals, there's occasionally pockets of bitterness. And hopefully, I hope you haven't seen it, but I'm sure many of you have. The registrar, I won't say which team, the registrar who's short at you on the phone and yells at you down the phone, why would you call me for that? Who do you think you are? That sort of thing. Remember, everyone starts somewhere. Everyone's calling someone for a reason. And the reason why they're calling is usually to ask for help. So don't berate them over the phone. Be kind and you'll receive kindness back. If someone is being mean to you, I don't think it's acceptable. We're in a workplace and we should all be working together. But if that happens, don't feel that you're given a pass to be angry to someone else. Just go, okay, fine, put it to a side and then get on with your day. I'm not talking about bullying and, workplace issues and things like that, but I'm just talking about attitude, really. And keep an eye on the end game, which Jen mentions. Well, I'm going to talk a little bit about CVs. So these are things to consider in your CV, and I don't think you need everything on this for you to be stand out, but I think a lot of your CVs at the moment will look pretty vanilla. And they'll all be pretty similar like if we looked at all of you as a group. So just try and think to yourself, where are the gaps in my CV and what can I do to make myself seem a little bit more attractive to an employer next year? And these are some of the things that you can consider doing. So professional development or courses, don't go overboard. There are a lot of people who sign up for $20,000 master's degrees and things like that. Personally, I don't think you need to do them to get a job, but some people find the courses interesting and enjoyable, and if you're doing it for those reasons, then they're the right reasons. Research, publications and posters. If you're looking for research things, ensure that it's a contained project. So there are often times when a supervisor will go, oh great, I've got a great idea. I want you to survey all these people, collect the data. We need to get about 4 years of data to have a bigger enough sample size, and then we'll write it up. And you think, well, I'll have finished my training by that stage. It won't help me. It won't help my CV. So if you're looking for research projects, ask them, have the ethics been put in already? What would be my contributional portion to it? Because if they're an uncontained project, it's unlikely you're going to have it on your CV before even your advanced training interviews at times. Quality improvement or audits are very easy around the hospital. There's heaps of them to do. You just need to really look around the hospital to find them. And it really, I think it does go to that selfless attribute that we're looking for in medical registrars. But we can also tell, having sat through a few interviews, we can also tell the people who seem to just join committees for the sake of joining a committee. Join a committee that you're interested in, that you're passionate about, and that will come through in your interview as well. Teaching education presentations are pretty self-explanatory, but make sure that when you're writing your CV, you remember even the case presentation which you did at the neurology department meeting, which was just a weekly meeting, but it's more than someone else might have done in their resident years, so don't forget to put those things on your CV. Try to teach for the university, teach some medical students. Teaching is one of the best ways to learn, so I think it's a great thing to do, not just for your CV, but for your own education. I talked a little bit about committees and teams, and that sort of can reflect some leadership as well. But if you're actually taking a leadership role within those committees, then that helps as well. And if you're lucky enough to have had some prizes or awards, they're good too. So look at those in your gaps and try and plan out your year this year to see whether you can add anything to your CV so it's not as vanilla. Although I like vanilla ice cream as a general, yeah. Time management. So it's easier said than done, and I hope that many of you have developed time management skills going through university. But now you're working a 40-hour, 50-hour, 60-hour week, and it's hard to add all the other stuff on top. So time management becomes very important. So these are sort of my time management tips, and it's sort of goal setting and time management. So create lists. I think most of you as interns have learned how to do lists with tick boxes. It actually works in the real world as well, not just on the ward. So create some lists with tick boxes and cross them off as you go. Set some SMART goals with timeframes, so they're specific, measurable, achievable, realistic, relevant, and have a time component as well. So don't set something without a time frame. Set aside specific time to do those goals. It's easy to write it down, but if you don't set yourself any time to do it, it's not really going to happen. And try offload some of the work that you don't need to do. So I have a cleaner because mess really annoys me, but I'm also pretty lazy, and so I don't clean myself. So I get a cleaner to do that, and she also does some of my ironing, but I used to send the ironing out before that. Some people like shopping online for the groceries because then the same shopping list, you can just reorder it the next week and it turns up. You've got something to say? Hello Fresh. Yeah. They're meals, aren't they? Yep. And there's quite a few pre-prepared meals that are available. And AirTask is a sort of a fairly new thing where you can just hire someone to do anything you like. Almost anything, almost anything. And so if you have some spare jobs that need doing, then get them to do that. And I mean, I've had some tasks around the house which I know would have taken me 4 or 5 hours to do, and hired someone that's taken them an hour, and I've saved myself 5 hours, and I could use those 5 hours to see my family, enjoy time with friends instead. So to see about things that you can offload to other people and maximise your time. This is written by the the Royal College of Physicians and Surgeons. They're sort of like the RACP in Canada, but a lot bigger. They've written this time management guide, which is an excellent read. It's available on Kindle, and I think it's only available on Kindle. You might be able to buy it and have it posted to you as well. But Kindle's a free platform to use. It only costs about $4 or something like that. It's mainly written for consultants, but it adopts a lot of methodology from the 7 habits of effective people. Is that the book? Seven Habits of Highly Efficient or Effective People. It's a book like that, but they've adapted it towards physicians. So I think it's particularly useful. It's a very quick read, and you can probably pick out the things that apply to you versus those which are applying to a consultant who's got an office job as well. So how do you identify, manage, and seek help for stress and burnout? And this is sort of some of the things which I really want to get onto today. So the first thing is to know the warning signs. You need to be able to identify them in yourself and also in your colleagues. So if you notice that you're angry with other people and you're not normally an angry person, or you've got a shorter fuse than you usually do, then consider that. Some people are just angry all the time, you know. That's their shtick, that's fine. But if it's a change in yourself that you've noticed or in your friends, then pick that up. You dread coming into work, or you're avoidant. You don't volunteer for overtime shifts, or even you're calling in sick for overtime shifts because you can't bear coming into work, or you're trying to give away your shifts. Reduced cognition. This is more of an advanced sign. So you find that you're not remembering your patients as well as you used to. You can't keep all the information in your head. There's too much going on. It's all jumbled up. Be aware of that. Lack of energy, anhedonia. So even on the weekends when you're away from work, you're not really enjoying the things that you used to. I mean, these are things which we sort of read about in medical school, but we always think that they happen to other people. But mental illness, and it's not even mental illness, you can think of it as mental illness, but it's really stress and burnout as part of a scale down. And not being able to enjoy things anymore can be a sign that work is intruding a little bit too much into your work-life balance. Overly sharing frustrations from work with family and friends. And this is more, a lot of medical people hang out together and will often share stories about work, and that's fair enough. And if you've got a friend who's a non-medical person and they're in that group, then they'll be pretty bored. But I suppose it's more than that. It's when it becomes a rumination, where someone becomes so frustrated in the retelling of that story, and then they get angry almost thinking about it. It's a sign that maybe work's intruding a little bit too much. And drinking to excess or using other drugs is obviously a sign, but I think too often it's not thought of. I think particularly in Australian culture, where drinking is fairly much accepted as a cultural norm, we don't pick that up as well as we should. And drinking to excess can interfere with your work. I remember a colleague of mine when I was a BPT. I was a BPT 2, so first year med-reg. And we came in on the Saturday morning, and the BPT who I was doing the shift with was really hungover, and she'd been drinking too much. She'd been drinking too much, and it was the first warning sign that I picked up that there was something wrong with her, and we had a chat about it. We talked about it and talked it through. We sent her home so that she could get over it, and we eventually got her a meeting with some support people to help her through it. But be aware of it, because I think there's a difference between someone who's drinking to excess and that's just their cultural norm, and someone who is drinking and it's a sign that they need help. So what next? So for self-help, I suppose try and reflect on your pattern of behaviours first. So is there an underlying cause that you can identify that needs addressing? And if you do find it, think, do I need to seek help, or can I talk it through with someone else? Mindfulness is a great strategy to learn if you're not even with work stress, but a whole bunch of things. So if you're prone to anxiety, if you're prone to a depressed mood, if you're prone to ruminating, mindfulness is a type of meditation where you essentially focus on the breath and allow other things to move past you, so that you can clear your mind and focus on the task at hand. And if you learn the techniques of that relatively early, it makes it quicker to become more calm in the future. So for those of you who do suffer with a bit of stress or anxiety, mindfulness is something to have a look at. So where can you seek help? So a lot of you will have a PDA, but your supervisor, or if the hospital's assigned your mentor, they're a good place to start and speak to. Your DPET, so you're all lucky, because you'll often have both a Director of Pre-Vocational Education Training as well as a Director of Physician Education. And depending on your comfort, you might be able to go to one or the other to ask their advice. The Director of Physician Education I mentioned, and there's also the Training Support Unit at the RSCP, but really they're probably a secondary resort to people who are probably closer to you at work. So where else to seek help if you need some more professional help? So your GP, obviously, and hopefully you've established a relationship with your GP already, because it was on your to-do list that I mentioned earlier. The EAP, the Employee Assistance Program, every hospital has an EAP. You just have to contact Switch and they'll put you through. It's free. They'll set up some time for you. They're fantastic. They're really, really good resource, and I think really underutilised by medical staff as a whole. So give them a call. You can just talk things through. It doesn't go back to your employer. It's not recorded anywhere that you've attended. So it's a great place to go. There's also the Doctors Health Advisory Service, and you can just phone up the number, or you can have a look at their website and look at the services they provide, but they also provide support for doctors who are undergoing stress or mental problems. They're run by a benevolent society, so they try to help where they can. So look out for your mates as well. For stress, anxiety and depression. And if you see a change in them, what are you going to do? So if you see a friend in need, try to be a friend indeed. If you can, and you can't always do this with people, but if you can, discuss it with them and talk it through, see if you can find out. And this girl who I helped when I was a BPT, we were fairly good friends and we could talk about it. Encourage them first, in the first instance, to discuss it with their supervisor or the DPED or the DPE or the EAP or the DHAS. All those acronyms are helpful for people. But if they don't, you need to think about their safety as well as patient safety. And if they're at risk of hurting themselves or hurting other people, then it's a sign that you might need to escalate it to one of those other people that I just mentioned, yourself. Because suicide in medicine is not often talked about, but it does happen, and I think that it's really important that these things are addressed earlier rather than later. So I remembered what I was going to say before. So it was about the college in New South Wales Health. So moving topics, because that was quite somber. So sorry, let's wake up and cheer up a bit. So when you're handing in forms to the college, make sure you keep a copy yourself, because a lot of stuff, the college is huge. They get in thousands of paperwork from all over the place, and occasionally things go missing. And unless you've got a copy to back up what you sent them, then you essentially haven't finished your training. So that's really important. Your end-of-term reports, the ones which are done by HETI, are good enough for the college to use as your end-of-term reports. So that's fine, but make sure you get a photocopy of them before you hand them in. Because although you probably give them to your JMO manager, most places, so although the JMO manager takes them, she has nothing to do with the college. Because remember, employment and workforce, completely separate. So make sure you take a photocopy beforehand, or just take photos of it on your phone so that you've got a copy of it. Or even better, sometimes some units have a photocopy that you can scan and email it to yourself. So you get a nice copy. That's even better, because then you've got the copy in your email. It won't go anywhere. But any correspondence you have with the college, make sure that you keep a copy yourself, so you've got evidence that you have submitted it in the correct time frame. That sort of ties up my talk, but I'm happy to take any questions now, or we can talk about it in the panel. All right, let's have the panel, and we'll talk. It'll be a little bit less intimidating. Really? They are directors' chairs. Yeah.